So today we're talking about third-party risk. Let's get started. So when we talk about cyber risk, most people picture hackers breaking into systems, but really the biggest threat for healthcare organizations today may come from the companies that we rely on every single day.
You're looking at your payroll providers, your cloud services, your claims processors, your medical device manufacturers. These are all of our third parties, and when they go down, we can go down in healthcare as well. So over the last year, we've been listening to healthcare leaders across the country on this issue, and the message is really clear. Third-party risk is no longer just a security problem, this is a business problem. And we've really seen it firsthand. A single outage at a vendor can stop your paycheck from getting to your employees. It can delay appointments for patients. You can get your clinicians locked out of the tools that they're trying to use. And one executive shared with us as we're doing this research recently that everything works until it doesn't, and then it just becomes chaos. So many of our conversations that we've had, the leaders have admitted that their current approach to third-party risk is focused on paperwork, checklists, really not on making sure that there's care that continues when a partner fails. And that gap is really why we want to bring this conversation to the executive level. Leaders have highlighted with KLAS that there are 3 blind spots that executives should be aware of. First, operational continuity. So most organizations assume that vendors will always be available until they aren't. Second, prioritization. So we often treat vendors the same, even though only a small percentage are the ones that could bring our operations to a halt. And then third, fragmentation. So you've got different departments that are relying on the vendors. You've got your IT, security, operations, finance, and everyone evaluates the vendors separately so no one sees like the full picture. That's how healthcare ends up spending months on low-risk vendors while they're missing the real points of exposure. So what does better look like? Imagine this, okay? We've got a clear shared dashboard that shows vendors that are truly critical to your hospital or system, what a business impact would be if they went offline, and what contingency plans exist. Think about your payroll, your claims, your scheduling, the lifeblood of your operations. For those vendors, you want to have backup processes in place and tabletop exercises to make sure that they actually work. And for everyone else, a lighter weight approach. That could be fine. This is all about aligning attention and investment on where it really matters. So there's actually an important message for vendors here. Healthcare needs more than just a compliance report. They need real transparency into how you'll support them when things go wrong. Some forward-thinking vendors are even drafting contingency playbooks for their clients, outlining exactly what they'll do in the event of an outage. And that's the kind of partnership that builds trust and protects patient care. So the executives we've been talking to have also raised new challenges like the rapid adoption of AI across the many vendor platforms. And on one hand, AI can help us by speeding up the tasks and catching risks earlier, but on the other hand, it adds new data and security exposures if it's not well governed. That's really the key takeaway for leaders. Like, don't just treat AI as just another feature. Ask your vendor how they're safeguarding the data and how it affects your risk. Okay, the bottom line is this. Third-party risk isn't about questionnaires. It's about resilience. And as an executive or a leader in healthcare, your role is to make sure that your organization can keep caring for patients, keep paying staff, keep the lights on even when your partner goes offline. And that means asking different questions. Thanks for listening in about third-party risk. We have some really impactful research that's coming out in the next couple of months on this topic. We would love to hear from you if third-party risk is a challenge at your organization, or if something's going well and you want to share some of the innovations and what you feel like the future of third-party risk should look like.
Don't forget to like and subscribe if you enjoyed the content today.